Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, I'm joined by Eric Bacon, the president at AMD Global Telemedicine. Eric, how are you today?
I'm doing great, Jared. Thank you.
I'm excited for us to chat. I tell a couple of the people I met at the American Telemedicine Conference that I don't get to meet too many of the people that come on as guests in person. So it's always special when I'm able to meet you there. And you guys obviously had a great, huge booth in the middle of the conference with this giant cube, which I'm sure a lot of people were wondering what that was. Looked like the coolest place to play video games, also, if that was possible, but it had health purposes. But yeah, so really excited. Glad I was able to meet you, and yeah, thank you for coming on the podcast. I think we should dive right into it. If you could tell the audience a little bit about your background, I know they would really appreciate that.
Yeah, sure. Thank you, Jared. And thanks for the nice words about ATA and AMD. I'm Eric Bacon. I'm the president of AMD. I've been with the company now for 22 years. I started my professional journey with nothing to do with healthcare. I went into the finance industry and worked for KPMG as a public accountant, public auditor, and then found my way into healthcare through finance. And in many years, I served as the CFO of AMD. And in that capacity, over the first 16 years of my career, I was able to learn about many different devices and how they connect and different challenges that the world faces in integrating them. And for the last 5 years, I've been the president here at AMD. And through that 22-year journey, we're bringing specialized healthcare to some of the most remote and desolate parts of the world and increasing access to healthcare. And as I look back at myself and what I expected to achieve in my professional career at the age of 21 and what I've done, it's been a fun journey.
Well, thank you for sharing, Eric. I'd love if two pieces to this next thing. I'd love to hear more about you. Kind of gave us how your career started and transitioned into AMD. More about the company for those that maybe are not familiar with it, and then as you wrap that up, quickly tell us both your experience at the ATA, because I know obviously you guys had a good location. Seemed like you were making some good relationships. I'd love to hear that as well. Obviously, the ATA is a partner of ours. We're super, grateful that we were able to attend and cover the event. But yeah, would love to first hear more about AMD, and then kind of tell us a little bit about that experience with the ATA.
Yeah, it's great. It's interesting. We're having a conversation about ATA and AMD. AMD is one of the early founders of telemedicine. We're a 32-year organization. We are one of the first companies to do telemedicine in the world as we know it. Founded in 1991. I think the first ATA conference, we were one of three members that helped found that. And through the legacy of the ATA, different leaders of AMD have served in different executive positions within that group, whether it's on different advisory boards and whatnot. So they've been a big part of our journey as a company. But AMD, as I mentioned a bit ago about myself, we've focused on initially early on in our company, medical devices, connecting this device to a codec here and delivering that image or sound somewhere else in the world, the tele aspect of it, and then validating the quality and the connectivity of that. And over the years, AMD has shifted to more of a software company. And if someone asked me today, what are we? I'd say we're a software company. And so when I started in this industry with AMD, we were doing video over ISDN lines. I mean, you had to have 6 telephone lines, and to do a 1-hour video call to India was a $600 call. But now, with broadband and the advent of the internet, it's essentially free. And so as medical devices have gone from these $10,000 ENT scopes to as low as a $400 ENT scope, and it's digitally connected and it's a higher quality, it's really made it affordable to the masses. So over those 30 plus years of AMD's life, we've done telemedicine installations in 106 countries around the world. And that number is growing. And so when we say, our our mission is to bring specialized healthcare to the most underserved and remote parts of the world. We've actually lived that. So that's what we are now. AMD is a software company. We that's our biggest department here. We've developed our own software. We integrate to over 40 different medical devices. So, you look at some of the software-based video platforms that are out there. It does video, which is great, and maybe it connects a camera or a stethoscope for sound. But typically, when that encounter is done, the encounter is done. With our platform, you have those capabilities as long as scheduling and workflow, but we integrate that right into an EMR. So you have that continuity of care. Doctor can log into their calendar, see an encounter, see they're going to do an encounter in California or in Canada or another part of the world. With a click of a button, they're in that encounter. And at that point, they're consuming physiological vitals. They're getting sounds, they're getting images, an X-ray, ultrasound. And it just keeps going. And we capture that, and we can actually push that back into the patient's electronic health record for future reference. And that's a big difference of what we do, what others do. So we're a software company. Like I said, we integrate well over 40 different medical devices, and we work through channels around the world. The ATA this year was great. As you mentioned, we launched the H3 Cube through our partnership with Unidoc. So when you get to some of these developing nations around the world, you go to places where they don't have security. What I mean by security, not physical security, but security of the devices, of the equipment. Is it dry? Does it have internet? Is it powered? All of these are basic challenges that we may face here, but in other parts of the developing world, they're not just foregone conclusions. So with the cube, we bring that to them. We bring that cube to them that has its fully turnkey system with our software, with our devices, and we come in, we install it, we train it, we support it, and now you've just brought a whole um, full circle of healthcare to that community that didn't exist 2 days early. So being able to show that at ATA this year was wonderful. The show was great for us. We get to see so many existing customers, meet new customers, talk to partners and vendors all in one space. And ATA does a really good job of bringing all those people together. And this year, I think they did an excellent job of with their panels and their sessions. I thought it was extremely knowledgeable. So they're doing a really good job in advocating for the space. We're happy to be a part of that.
Yeah, they definitely did a good job. It was cool to come back to Boston. Real nice for you too, in terms of how close it was.
Yeah.
Uh, but yeah, we'll see how next year's event is. But hopefully it's like how this year went. And for the audience, if they're trying to picture what this cube looks like, we took a video of you and did a little teaser a couple weeks back of you in the cube at the conference, so they can kind of get a picture of what that kind of looked like, the size of it and everything. But super cool. Um, Talking more about that, in part of one of the things you did was you talked me through how you're basically helping bring care to everyone, right? And you were telling me a story about this community in Ghana. I think it'd be really cool for the audience to hear that story directly from you, because it was pretty. It was a pretty interesting story.
Yeah, yeah, and that's one of many, Jared. And thanks for bringing that one up because it's a great example. You know, for the adoption of telemedicine in developing nations, you have lots of barriers, right? Some of them I mentioned just a minute ago, but you also have this whole model of hey, this capital expenditure, hey, this big cube, which is a small, building with all of this medical equipment and software and installation and support. The barrier to entry is, in many cases, it doesn't make it feasible. So through our partnership with Unidoc, they turn that into a population-based model, more on a population fee for a person, fee for encounter, but they bring the cost down where it's something that can be doable for those communities. So Ghana is a perfect example. We're going into communities there, If you go to Unidoc's website, you can read about what we're doing there. But what we're doing is we're bringing in into communities in Western Ghana where there is no access to healthcare or the limited access to healthcare. And so what we're doing is, in partnership with Unidoc and TD Synex and others, is we are bringing this cube into these communities, training the locals on it, how to use that. Remote doctors will be able to provide care to them around the clock or for however long they want that. But now imagine going into a community where there is no healthcare today, or very limited access to healthcare, to where tomorrow they can walk up to the clinic and it's open from 8 a.m. to 8 p.m. and they can see a doctor on demand. And we have all the tools there. And, it's a really interesting story. We all get older. I'm going to be 50 this year, and I find I get emotional at every turn. I'm now a grandfather. And when you sit back and you look at the celebration, when this one community was told they're going to get this system in their community, they broke out into song and they broke out into dance, and people were crying. And when you really sit back as a professional, as a human, and think about how you're impacting that community and delivery of care to that community, you really start to think about the legacy that you're leaving and being a part of. It's not, my legacy; it's the group legacy. But it's transformative overnight in that community. We're starting out with 400 different communities covering a population of 2 million people, and that's the pilot. And I could sit here and name 4 other countries in Africa that we're going to similar projects with the Health Cube. Here in the United States, we're going to be doing the Health Cube in the city of Tucson, I believe, bringing it to people who are homeless, who don't have care. Same aspect, but bringing access to a community that doesn't have it today, Aboriginals, etc.
Thank you for sharing, Eric. As we get ready to wrap up here, what's next for AMD that you can share?
Well, so AMD fits within the whole entire healthcare continuum. We're talking about community-based rural care here. But when I started in this business, everything was rural. We literally were at the space station on both ends of the pole. But now telemedicine is at the local pharmacy around the street. At the end of the day, imagine you're here in the U.S. The thought of having a hard time getting a hold of a doctor means I might have to wait till next Wednesday to see a doctor, right? But in other parts of the world, it's a long period of time. But whether it's doing acute rounding at a hospital or skilled nursing facilities, hospital in the home, pharmacy care, telemedicine is here now. It is in every aspect of healthcare. So what's new? What's next for us? We're excited about 2022, 2023 to expand on what we've built for the last 32 years with that increased adoption. The Unidoc partnership launching within many, many countries here in the U.S. and around the world, and launching with another partner into the tele-ICU, as we were also showing at ATA, where we're going to be able to bring the tele aspect into an ICU so we can start to bring intensivists into a live encounter in the ICU and really transform how care is done in the ICU. It's going to be an exciting year.
Well, I look forward to staying in touch with you, Eric, and continuously learning more about AMD. So great to meet you in Boston. I look forward to our future conversations, and thanks again for being a guest today.
You're welcome. Thank you.